Hi guys, today's video we'll mention syphilis causes and how to diagnose. What is syphilis? Syphilis may be a high contagion that's mostly spread through sexual intercourse, including oral and sodomy. The infected person often doesn't know that they have the disease and passes it on to their sexual partner. Syphilis was once a serious public health threat. It can cause serious long-term problems like arthritis, brain damage, and blindness. There wasn't an efficient treatment until the late 1940s when the antibiotic penicillin was developed. What causes syphilis? Syphilis is caused by the bacteria Treponema pallidum. These bacteria can enter your body through cuts on your skin or through your mucous membranes. Syphilis can't be spread by toilet seats, doorknobs, swimming pools, hot tubs, bathtubs, shared clothing, or eating utensils. Those are the syphilis risk factors. You're at higher risk of getting syphilis if you 1. Have unprotected sex. 2. Have multiple sex partners. 3. Have HIV. 4. Are a person who has sex with men. Syphilis symptoms. Syphilis infection has 3 stages. 1. Early or syphilis. People with syphilis get 1 or more sores called chancres. They're usually small painless ulcers. They happen on your genitals, on your anus or rectum, or in or around your mouth between 10 and 90 days, 3 weeks on average, after you're exposed to the disease. Albeit you don't treat them, they heal without a scar within 6 weeks. But treatment will keep your disease from moving to the subsequent stage. 2. Secondary syphilis. This stage begins 6 weeks to 6 months after you're exposed. It's going to last 1 to 3 months. People with syphilis usually get a rosy, copper-penny rash on the palms of their hands and soles of their feet. They'll even have different rashes on other parts of their body. These may appear as if rashes caused by other diseases. People may have moist wart-like lesions in their groin, white patches on the within of their mouth, swollen lymph glands, fever, hair loss, and weight loss. Like with syphilis, symptoms of syphilis will recover without treatment. Other sorts of syphilis include 1. Tertiary syphilis. If the infection isn't treated, it's going to advance to a stage marked by severe problems together with your heart, brain, and nerves. You'll become paralyzed, blind, or deaf, or get dementia or impotence. It can even be deadly. 2. Latent syphilis. The infection doesn't have any noticeable symptoms but remains in your body. 3. Congenital syphilis. A pregnant woman with the disease can spread it to her baby. It can harm the baby and even cause death. 4. Neurosyphilis. The infection can spread to your brain or medulla spinalis. You would possibly get headaches, dementia, or numbness or become paralyzed. You'll have a tough time controlling your muscles. Syphilis complications. If you don't get treatment, syphilis can have complications everywhere your body. 1. Small bumps. Bumps called gummas can grow on your skin, bones, or organs. They will destroy the tissue around them. 2. Systema nervosum problems. Syphilis can cause problems like headaches, meningitis, brain damage, paralysis, or hearing and vision loss. 3. Cardiovascular problems. The disease can damage your heart valves or cause bulging blood vessels, aneurysms, or an inflamed aorta, aortitis. 4. HIV. Syphilis can increase your chance of getting HIV. Syphilis effect when in pregnancy. The CDC says women should be tested for syphilis a minimum of once during pregnancy. It's best if they're tested at their first prenatal visit. Counting on how long a pregnant woman has had syphilis, she features a high chance of stillbirth, birth of an infant who has died before delivery, or of parturition to a baby who dies shortly after birth. An infected baby could also be born without symptoms but could have them within a couple of weeks if the disease isn't treated directly. These signs and symptoms are often very serious. Untreated babies may have delays in their development, have seizures, or die. Syphilis Diagnosis and Tests. Your doctor will get to do a physical exam. They could offer you tests including 1. Blood tests. A fast test at your doctor's office or a public health clinic can diagnose syphilis. 2. Spinal fluid tests. If your doctor thinks you would possibly have neurosyphilis, they'll test fluid taken from around your medulla spinalis. 3. Dark field microscopy. Syphilis bacteria are visible through a microscope in fluid taken from a skin sore or lymph gland. Thanks for watching this educational video. Please refer to the next video, we'll mention the way to cure and stop syphilis diseases. Please do not forget to subscribe to our channel for more recommendations on health, relationship, lifestyle and other helpful information to form your life easier.